Good morning. Today is Thursday, January the 28th, and this is our weekly COVID-19 update briefing. As of today, Bossier Parish has experienced 11,514 positive cases. That's an increase of 688 since last week. It's just continuing to surge on our community. And unfortunately, we've had 10 more deaths since last week, bringing our total to date to 234. All 64 parishes in the state are experiencing the spread of the virus. This is a concern, and Governor Edwards recently stated that the number of cases is at an all-time high and that we haven't peaked yet. He said it's going to get worse. It's been reported that about 2/3 of the states are now experiencing a surge of the virus. And now, 1 year after the first case of the virus, deaths in the United States have exceeded 420,000. The first known variant of COVID-19 is now in Louisiana. Other variants are emerging. Some medical experts say that the existing vaccines will be effective against these variants, but that more research is required. The Center for Disease Control indicated these variants from the United Kingdom and from South Africa are more contagious than the original virus, and they transmit at a higher rate, and that is the real problem. This results in more people getting the virus and more patients' hospitalizations and regrettably more deaths. Hospital officials have indicated that the trajectory of cases, if continued unabated, will overwhelm their facilities. Some are at or near that point. The governor recently stated that should there be an increase in the number of confirmed COVID-19 cases, the percent of positivity related to hospitalizations will threaten the ability of the healthcare system to properly respond. It may, and I repeat may, he said, be necessary to go back to the full restrictions in the stay-at-home orders of a previous proclamation. The governor has conceded that strict enforcement of his directives is not feasible. He urges, though, that we be good neighbors and voluntarily and consistently comply with the prevention and mitigation protocols. The vaccinations have begun in our local area, but regrettably, there has been a serious problem in distributing them in the number of vaccinations that had been projected for the end of December. The impact of a new president and his administration positions, directives concerning COVID-19 is not yet clear. Governor Edwards is having a press conference today at 2:30 p.m., which may provide some insight, but one would expect that there will be a lot of emphasis on distributing more vaccines where they can be administered as soon as feasible. In Louisiana, the Department of Health has established priorities for individuals to receive the vaccine, and it is as follows. In Phase 1A, you have 3 categories. The first, hospital personnel. The second, nursing homes and long-term care facility residents and staff. And number 3, first responders to serve as vaccinators, people like EMS people who can help administer the vaccinations. In Phase 1B, Tier 1, there are 9 categories, and they are persons aged 70 or older, outpatient clinic providers and staff, urgent care clinic providers and staff, community care centers providers and staff, behavioral health clinic providers and staff, dialysis providers and recipients, dental providers and staff, and finally, number 9, schools of allied health students, residents, and staff. Vaccination for the general population is still projected to be in the May-June time frame. Eventually, all pharmacists, clinics, and other locations in all 64 parishes have or will have received some quantity of vaccines. However, the demand greatly exceeds the supply at this point, point, 'and' 'and 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 There is evidence that more people are receptive to taking the vaccination than previously reported. Some, however, refuse it on the grounds of religious or medical reasons, but others simply prefer not to take the shot. As previously reported, it takes approximately 75 to 85% of the populace being vaccinated to achieve herd immunity. If a significant number of people refuse the vaccination, we may not achieve immunity. The effectiveness of the vaccine will be minimized if large numbers refuse to take the vaccination. It's estimated that the number of individuals who are asymptomatic is around 50%. They do not develop the symptoms or show it, but they can transmit the virus, infect others, and unfortunately result in more illness and deaths. The governor has previously directed that wearing a mask as being a major concern, and he has directed that every individual in the state of Louisiana, age 8 or older, shall wear a face covering over the nose and the mouth when inside a commercial establishment or any other building or space is open to the public, whether indoors or outdoors, and this includes public or commercial modes of transportation. The Center for Disease Control now also recommends that children aged 2 to 7 wear a mask, but that is a recommendation. Governor Edwards pointed out recently that the number of vaccines now approved and others in the pipelines are showing us the light at the end of the tunnel for recovery from this pandemic. But what is needed now is for all of us to comply with the prevention and mitigation procedures to get through this crisis period. We've got to get through this tunnel, and how we do that with a minimal loss of life and impact on a citizen of the national economy is complying with the prevention and mitigation protocols. The Center for Disease Control and Louisiana Department of Health have determined that the number of days a person should remain in quarantine can be shortened to 10 days on day 11 if no symptoms have been reported during the daily monitoring. Also, they say that quarantine can be shortened to 7 days on day 8 if the individual takes the COVID-19 test and receives a negative result. It's hoped that these shorter periods will encourage more people to receive the vaccination. And the Department of Health still recommends, however, a 14-day quarantine period for people, residents and staff of congregate living settings such as nursing homes and correctional facilities. The state's most recent number of positive cases is 10.5, which is a significant improvement. However, it's still above the goal of 5% or less, but it is a significant improvement over last week's report. And the prevention and mitigation protocols have not changed. They are as follows. First of all, and very important, wear masks. Second, wash your hands for at least 20 seconds. Practice social distancing of at least 6 feet. Do not touch your face. Disinfect surfaces frequently touched, such as doorknobs, handrails, and such. Cough into the bend of the elbow. If you're sick, stay at home and comply with the directives of your medical provider. And as always, avoid crowds. Governor Edwards is pleading that we all comply with the mitigation and prevention protocols. This, he says, is our best defense against spreading this virus to our family, friends, and throughout the community. Thank you for your continuing participation in this joint fight against this deadly pandemic. Our next scheduled briefing will be Thursday, February the 4th. This concludes today's briefing. Thank you and good day.